Have you ever noticed how the body changes over time? Some of these transformations are subtle, while others are more evident, but they all have a direct impact on health and well-being. Today, we're going to talk about an essential topic that is still shrouded in taboos and misinformation: the changes in the vagina after the age of 60. This content is purely educational and health-focused. It has nothing to do with pornography or any inappropriate topic. Our goal here is to bring knowledge and present solutions so that you can live this phase of life with more comfort, health, and self-esteem. Many women notice changes in their intimate health as they age, but few speak openly about it. Fear, shame, or even the belief that these changes are inevitable cause many to stop seeking proper information and care. But did you know that there are many natural and accessible ways to minimize the impacts of these transformations? If you want to know how to deal with these changes in a healthy way and discover effective strategies to maintain your intimate health, watch this video until the end. I will share scientific information and natural practices that can transform your quality of life. Before we continue, I want to extend an invitation. Subscribe to the channel and activate the notification bell. Here, we address essential topics for women's health in a clear and responsible manner. If you value your well-being and wish to age with more vitality, this is the right place for you. Now, let's get straight to the point. What happens to the vagina after the age of 60? Over time, a woman's body undergoes various hormonal transformations. One of the most significant changes occurs during menopause, when the production of estrogen, the main female hormone, begins to decrease drastically. This hormone is essential for vaginal health, as it maintains the elasticity, natural lubrication, and resilience of the tissues in the intimate area. The reduction in estrogen can lead to vaginal atrophy, a condition characterized by the thinning of the vaginal walls, loss of elasticity, and decreased lubrication. These factors can cause symptoms such as vaginal dryness. One of the first signs of estrogen decline, natural lubrication becomes insufficient, causing everyday discomfort. Irritation and itching. The drying of the vaginal mucosa can cause persistent discomfort. Pain during sexual intercourse. Without sufficient lubrication, friction during intercourse can be painful. Increased risk of infections. Changes in vaginal pH make the area more susceptible to infections, such as candidiasis and bacterial vaginosis. Loss of elasticity. The decrease in collagen and blood circulation in the vaginal area can make the tissues more fragile and less flexible. It is fundamental to understand that these changes are natural, but they do not need to be accepted passively. There are many strategies that can help maintain vaginal health and ensure a more comfortable and balanced life. How can we minimize the impacts of these changes? The good news is that there are simple and effective solutions that can alleviate these symptoms and improve the quality of life for women over 60. Let's talk about some of them. Natural moisturizers and lubricants. Vaginal moisturizers based on hyaluronic acid and natural lubricants, such as coconut oil and aloe vera, help restore the moisture of the vaginal mucosa and relieve dryness. Hyaluronic acid, for example, assists in moisture retention and improves skin elasticity, while coconut oil has antimicrobial and moisturizing properties. Exercises to strengthen the pelvic floor. Kegel exercises, which consist of contracting and relaxing the pelvic floor muscles, improve blood circulation in the intimate region and help prevent urinary incontinence, another common issue after menopause. Use of medicinal herbs. Herbal medicine is a great ally for women's health. Some herbs, such as Peruvian maca and ginger, are known to help balance hormone levels and boost energy. Herbs like chamomile and calendula are indicated for sitz baths, as they have calming and anti-inflammatory effects. Diet rich in phytoestrogens. Phytoestrogens are natural compounds found in some foods that can help compensate for the drop in estrogen. Foods such as flax seeds, soy, chickpeas, and chia seeds are excellent options to include in your diet. Additionally, a diet rich in antioxidants, like berries and dark leafy vegetables, contributes to cellular health and hormonal balance. Massages with specific oils. Vaginal massage with vegetable oils, such as rosehip and sesame, is a practice recommended by Ayurvedic medicine to improve circulation and restore tissue elasticity. Modern therapies. Vaginal laser. Vaginal laser is a recent technology that stimulates collagen production and improves vaginal lubrication. This technique has shown effective and quick results for women suffering from intense dryness and vaginal discomfort. What does science say about this? Recent studies confirm that taking care of vaginal health goes beyond physical comfort. It is directly linked to self-esteem and emotional well-being. A study published in the journal Menopause revealed that women who treat vaginal atrophy report a significant improvement in quality of life and mental health. Another survey conducted by Harvard University demonstrated that healthy habits, such as balanced nutrition and regular exercise, reduce menopause symptoms, including vaginal discomfort. Now that you already know some natural and scientifically proven strategies to maintain vaginal health, let's talk about a fundamental aspect: the prevention of recurring infections and discomfort. In the next segment, we will explore how to avoid common intimate health issues, how to keep the vaginal pH balanced, and reveal a powerful sitz bath that can transform your quality of life. Stay with me, because at the end of this video, you will learn an effective natural technique that can be easily applied in your daily life. Now that we understand the natural changes that occur in women's intimate health after 60 and how we can minimize these impacts with healthy habits and natural treatments, let's deepen this knowledge even further. From menopause onward, the decrease in estrogen not only affects vaginal lubrication and elasticity, it can also compromise the vaginal flora, increasing the risk of recurrent infections, discomfort, and even impacting a woman's overall health. This happens because the pH of the intimate area changes significantly, becoming less acidic and consequently less effective in defending against bacteria and fungi. If you have ever experienced any of these symptoms or know someone who faces these kinds of issues, know that there are effective strategies to prevent and treat these changes in a simple and natural way. Let's explore some of these solutions now. Naturally balancing the vaginal pH. A healthy vaginal pH is around 3.8 to 4.5, which means the area is naturally acidic. This acidic environment is crucial to prevent the proliferation of undesirable microorganisms, thereby preventing infections. However, with the drop in estrogen, the pH can rise, becoming less acidic and more prone to infections such as candidiasis and bacterial vaginosis. To help maintain the balance of the vaginal pH, consider avoiding douching. It can eliminate the protective bacteria of the vaginal flora, leaving the area more vulnerable. Using neutral or specifically formulated intimate area soaps, using conventional soaps can alter the vaginal pH, causing irritation. Consuming probiotics. The lactobacilli found in natural yogurts and specific supplements help maintain a healthy vaginal flora. Avoiding tight and synthetic underwear. Prefer cotton garments, which allow the skin to breathe and reduce excessive moisture. Choosing the right lubricants. Many women report discomfort during sexual intercourse due to vaginal dryness. However, contrary to what many think, it is not necessary to simply accept this situation as something normal for the age. Besides the previously mentioned vaginal moisturizers, the use of water-based or natural oil lubricants can be a great ally. Coconut oil, for example, is an excellent option, as it not only moisturizes, but also has antimicrobial properties. Important tips about lubricants. Avoid products with fragrances or harsh chemicals. They can cause irritation and allergies. Prefer natural formulas. Coconut oil, aloe vera gel, and lubricants based on hyaluronic acid are good options. Test different products. Each body reacts differently, so it is worth trying and finding the best option for you. Physical exercise and its relationship with vaginal health. Regular physical exercise is one of the most powerful habits for maintaining health at all stages of life. In the case of vaginal health, it plays a crucial role in maintaining blood circulation in the pelvic region, helping to strengthen the pelvic floor muscles and prevent urinary incontinence. The best activities for this purpose include Kegel exercises. They are essential for strengthening the muscles that support the bladder and vagina. Yoga and Pilates. These practices work the pelvic floor, improve flexibility, and stimulate circulation. Walking and light aerobic exercises. They improve blood circulation and help in the natural production of collagen. Diet for intimate health nutrition has a direct impact on vaginal health. Foods rich in phytoestrogens, antioxidants, and essential fatty acids can help minimize the effects of menopause and maintain hormonal balance. Here are some recommended foods: flax seeds and chia seeds. Rich in phytoestrogens and essential fatty acids, they help regulate hormones. Dark, leafy green vegetables. They contain iron and magnesium, which are important for blood circulation. Berries, rich in antioxidants, they help protect vaginal tissues from premature aging. Fish such as salmon and sardines. They are a source of omega-3, which aids in the elasticity of the skin and intimate tissues. The power of sitz baths. Sitz baths are an ancient practice used to relieve discomfort in the intimate area. In addition to being relaxing, they help restore the vaginal pH, reduce inflammation, and provide relief for symptoms of dryness and irritation. Rejuvenating sitz bath recipe. Ingredients: 2 tablespoons of dried chamomile, 1 tablespoon of calendula, 1 liter of warm water. Instructions: 1. Boil the water and add the herbs, letting it steep for 10 minutes. 2. Strain the mixture and pour it into a basin with warm water. 3. Sit in the basin for about 15 to 20 minutes. 4. Repeat the process 2 to 3 times a week to relieve symptoms of dryness and discomfort. The importance of medical follow-up. Even with all these natural practices, it is essential to have regular gynecological checkups. Medical monitoring allows for the early detection of problems and the indication of specific treatments for each case. If you feel ashamed or afraid to talk about this topic with your doctor, remember that taking care of your intimate health is not a luxury, but a necessity. There is nothing wrong with seeking knowledge and solutions to improve your quality of life. Menopause myths you need to forget. After 60, the sexual life ends. With the right care, it is possible to maintain an active and satisfying sex life. Vaginal atrophy has no solution. There are many natural and medical options to relieve symptoms and restore intimate health. If there are no symptoms, there are no problems. Even without obvious discomfort, intimate health should be monitored and cared for. Conclusion: taking care of your intimate health is an act of self-love. Aging brings challenges, but it also brings wisdom. Recognizing the changes that occur in the body and learning to deal with them in the best possible way allows you to age with more health, self-esteem, and well-being. Now that you have reached this point, write in the comments, "I take care of my intimate health." This will help reinforce your commitment to yourself and may encourage other women to do the same. In the next segment, we will provide a final summary with the most important points and a special message for all women who wish to age with health and fullness.